Hello, everyone, and welcome to RevMD Sex Bites podcast with me, your host, Dr. Deborah Durst. So I am a traditionally trained MD that ventured into anti-aging and regenerative medicine about a decade or more ago and developed a passion for this new field of sexual medicine. And I want to bring you information about this exciting field on this podcast and get it out to more people. And as you noticed, we're not in the studio today, and we're on the road for interviews with crucial people that are going to bring you information about these exciting procedures. So anyhow, I have a guest with me today, and it's Paula Bruder, and she is going to talk openly with you about OShots and vaginal rejuvenation because she's had these procedures done, and she wants to talk to you about them, share her experiences so that you know what these wonderful procedures are about, and then are able to ask questions and experience them for yourself. So welcome, Paula. Why don't you go ahead and introduce yourself?
Thank you. I'm Paula Bruder, and I am 55 years old and very excited to share what I've found to be a new aspect of my orgasms and vaginal rejuvenation health after 40.
Yes.
And it can happen.
Yeah.
And it can be better than you imagine. And I guess my one thing I would look back and say is I probably could have done it 5 years earlier.
You could have done it sooner, right?
Yeah,
Exactly. So tell me, like when you first did it, was it vaginal rejuvenation that you did or the OShot
It was
first?
the OShot.
Okay.
And the very first one was around 40, 41.
Okay. And you were doing it, what were you experiencing that made you seek out the OShot?
It was stress incontinence, mostly from exercise at the time. I was still doing a lot of high impact sort of things. So on a jog, if it had been an extended period of time, I would find that there might be some leakage. Later, sneezing, coughing, that sort of thing. Nothing. It's always a shock, I think, when it starts, because you're just thinking, what? And you may give it away as just saying, oh God, I should have gone to the bathroom. But then when it becomes that you do those things
and interferes with your activities.
Oh,
and,
yeah, or you find yourself really happy that you're wearing, a dark pair of yoga pants or whatever, and you're
Thankful.
thinking, and you're thinking, what?
But you had how many children and vaginal deliveries?
All vaginal births. Three boys.
Three boys. Okay.
Yes, and my first child was when I was 23.
Okay.
And so he was my most difficult delivery, and so like I said, it started with that, and but then
well, even if you saw, so when you're going to OBGYN doctors like I did,
yes,
and you're having these issues, do they talk to you about anything?
I will tell you what sort of pushed me more to the OShot was at that time, my mother was about 5 years in from a bladder lift, and she did not do well from this. And she only had one birth. I'm an only child, and so I was thinking, oh, don't tell me. Don't come to me at 40 and say, you need a bladder lift or this is what you're going to have down the road. Because I was like, I'm watching what she just dealt with. I'm thinking, I don't want that.
No. And then, again, that's what they offer is surgical options, right?
There was no other option.
No other option.
Other than, are you doing your Kegels? Yes, I'm doing my Kegels. So
simple pelvic exercises and surgery.
Right.
Yeah. And so then basically the OShot, again, an in-office procedure, not a surgery, not a medication.
Right.
And how was it? So again, the OShot, if you haven't heard about it, and we've talked about it a couple times, but the OShot is a procedure we do in the office, and it's PRP. So we're drawing your blood, spinning it down, and getting the platelet-rich plasma part, which is PRP. And platelets have growth factors, and re-injecting them into an area to get growth of, nerves and blood vessels and collagen and elastin. So again, that area and space that support the urethra, which is also the anterior vaginal wall, which is the G-spot area, is like just obliterated basically with the weight of pregnancies. Right. And if you've had 3 boys, not small children, right? And then vaginal deliveries, all of them, so you're going to get obliteration of that space. And now we have a way to rejuvenate it without surgery, no medicines, actually no other way to do that, right?
Right.
Because surgery and medications don't do it. So now we re-inject those growth factors into that space that now are supporting the urethra, help with urinary incontinence. So how was it after? So it was an in-office procedure?
It was.
Was it painful?
No. Well, it was not. I think in my mind, I thought, how can I not feel something? Because it had been well explained what was going to take place. And so there was numbing with I can't remember if it was a block or if it was ice, but either way, I did not have pain when it was injected. So
nothing with it.
No.
And so again, Paula didn't have her original or her OShots with us. And so we now have talked about the procedures. And so again, she's very open to talking about it. So I wanted to bring her on because again, it's not about me doing the procedures. It's about how fabulous these procedures are, not about me, but about what you can gain from these procedures. And so again, not painful if they're well explained. There's a standard for which we do them. We're trained, we train physicians to do them. And when you explain it and you're blocking it the right way, women are normally going to be nervous with it, right? No matter what, until you've had the first one.
Yes.
But not painful, and shockingly not painful.
Yeah, very much so.
Because you're really not expecting that.
Right, right. Love the idea, just going back to when it was explained, the idea that it would be my blood that was, going back, that it was, the platelets going back that were mine. So how organic is that? I mean, there's
no medicines,
no
surgeries, nothing, just regeneration.
Yes, I mean, it's just amazing. It made perfect sense to me how that could happen.
And then it improved it.
It did.
How long did it take you to see improvement?
I actually, for the incontinence, I saw improvement that week, which it was, at first I was so encouraged that it was, I kept almost waiting for the balloon to bust just because it was like, are you kidding me? I can sneeze.
Right away, yeah.
It was like I can cough. I can jump up and down. I can do, jumping jacks. I can do squats that
when is this gonna recede? When is this gonna go away? Okay.
Now here's the thing. So I come in with needing the incontinence measure, and realize, guess what? I got a benefit of orgasm that is just so much. I've always been multiple orgasmic, yet with time, that became harder to duplicate each and every time. It was like I was thinking, oh no, is this an age thing too? And after this, I'm realizing, that was easier. That was better.
Yeah.
That was more.
And you weren't expecting that necessarily.
No, I wasn't at all.
Did they even explain it? Because way back, if you've had it a while back, again, it was done for incontinence initially.
Yes.
And we didn't realize the orgasmic effects.
No, that wasn't part of that very first one.
So again, how many have you had?
I have had 4.
Okay. All right. So, and again, we're using your own body's growth factors to rejuvenate tissue. So not a medication, not a surgery.
Right.
And you've had improved benefit each time?
I have.
And cumulative?
I have.
So it's gotten better and then better. And there's no end to how many OShots you can do. Again, it's a limitation of like how much you're willing to invest in your orgasmic strength.
Right.
Because your urinary incontinence improved.
Oh, on the first.
Immediately, yeah.
And it's still fine.
Yeah. And so again, I recommend a
After 10
yearly.
years, and I can literally say when I see an ad or something for, incontinence, and I see the sneeze of the girl coming and she's, covering her legs or she's crossing her legs or whatever. And I was just going back thinking, yeah, 10 years ago that was me. But, the fact that I did not undergo surgery to have that kind of improvement, to me, is just,
yeah,
wow.
Because that's what they recommend. And then again, you have to think outside of the box. So if you know about the OShot, there's no reason why you shouldn't seek a provider that does it, like close to you, find somebody right for you.
Exactly.
Again, somebody that's going to explain it, is trained well to do it.
That's right.
But again, you're using your own body's growth factors to regenerate an area, no meds, no surgeries, and improvement.
Right.
With your only other options with traditional medicine is surgery, which your mother didn't do well with.
No.
And so you didn't want to pursue that. But again, that maintenance. So I would already recommend about a yearly maintenance, but you're going to get cumulative orgasmic, sensitivity increase with each one of them, which also decreases with age.
Yes.
So were you noticing, like, you probably didn't even notice, because it sounds like it was kind of an insidious, kind of an added bonus, but you really didn't expect it.
It was, because I've, always being able to orgasm, and always being very sexual in that nature of, like I said, having, 2 orgasms, 3 orgasms, whatever, in a sexual encounter. That for me was a lifetime since I, in my 20s and 30s, great, no problems. And like I said, I don't know that I'd really said to myself, this is not as good, not as, not as, what's the word? It was just, it just wasn't as,
it's probably weaker,
rich. Just, I don't
a little
know the
weaker.
word.
Maybe it takes us a little bit longer.
Right.
Because what I see women complain about is, again, it takes them longer. And so if it's a couple, frequently the man, it takes, he's not as confident he'll keep his erection. So he's trying to rush through it. The woman takes a little bit longer.
That's right.
And so we want longer. They're trying to rush. So again, it's just we grow apart for reasons that we don't have to, because we can go ahead and rejuvenate, get more sensitivity, better orgasmic strength. And again, but if you don't know, you don't know until you know, it's better.
And one of the things that after that first OShot was that I like to say, I realized afterwards, it was like, that was a toe curling orgasm. And it was like, wow, okay. Okay.
I like that description. That's a good thing. Yeah.
So it's like, damn.
Yeah. And it gets better. So again, it's inevitable that women will have a decreased orgasmic strength with age. So, and if you've had childbirth, you're going to have that incontinence. You're going to have worsening of that orgasmic decrease, and not even really notice it until it becomes so obvious.
And here's the big obvious that occurred is also the fact that a vaginal orgasm would start to happen again, which had decreased off.
So it actually makes me want to talk about that a little bit, because some women don't think they experience vaginal orgasms, like up to 80% of women. And so I want them to know they're not alone with that.
Yeah, exactly.
Because a lot of women experience that. Although I don't know that there's strictly a vaginal orgasm, because the clitoris, again, wraps around the vaginal canal. People don't know that. They see the clitoris up here. They don't know that it comes down on both sides. So if they're having an intense clitoral orgasm, part of that is vaginal, probably. But for those women that like really feel a G-spot orgasm and that declines,
Yes.
you know, the OShot is the only thing that's going to bring that back. And the only thing that can potentially give somebody a G-spot orgasm that hasn't had one before is OShots. And it may be 1 or 2 or 3.
Yeah.
But again, the only way to potentially get that is with OShot.
And I think that's my cumulative in a large way. I think that has built up over the time.
Over time.
Yeah.
So, and you had vaginal rejuvenation too, meaning with laser.
Right.
So again, OShot is all of it's regenerative. So we're talking about regenerative, period. You know, where we're taking a local regeneration, whether we're doing PRP, and PRP again is platelet-rich plasma. We're drawing your blood, spinning it down, getting the platelets, re-injecting the platelets, which have growth factors, and that's the OShot. But if you pair that with vaginal rejuvenation with a laser, so the laser is actually heating the vaginal canal. Again, we can go into the anterior aspect to improve that urethral support and G-spot support, and, you know, increased blood flow, increased nerve stimulation, collagen, elastin. You had that.
I did. The last 2.
And the one that you had again was Juliet. Okay.
It was.
And so Juliet is an ablative laser. Again, all of them are going to regenerate, form collagen, elastin, nerves, and blood flow, and so increase support of the urethra and orgasmic strength with time. Again, pairs very well with the OShot. And in fact, I don't recommend them apart unless somebody's never had a vaginal birth. So if somebody's young, never had vaginal birth, doesn't have any laxity, or has maybe muscular issues like tightening, vaginismus, some kind of pain related to muscular contraction, then I don't recommend it. Other than that, you should do it in combination. So you did it in combination.
I did. The last 2 OShots were with the combination. I would say tightness and lubrication was better after having the laser.
Okay. So now a lot of people don't understand that lubrication is really blood flow. And so
Makes sense.
it's a filtration of blood flow. So like basically you get blood flow there, and an ultrafiltration of that is lubrication. And so if we're increasing blood flow to an area with an OShot or vaginal rejuvenation with a laser, all of it's vaginal rejuvenation. So I should just say laser rejuvenation and OShot, you're increasing blood flow, and then you had increased lubrication with it.
Oh yeah, definitely. And the tightening definitely too.
Yeah.
And yeah, so
And almost immediately.
Oh, yeah.
Because a lot of women, when we're doing the procedures, will notice tightening, feel it. And again, so with ours, did you go on the outside at all with the Juliet?
I did.
Okay.
Yeah, I did.
Yeah. So you can get tightening on the outside as well with the laser rejuvenations, which you can't with the OShot. So we go on the outside, and because we'll get laxity there, just like we get laxity in the vaginal canal. And so with the laser, you're heating up the entire vaginal canal, stimulating collagen, elastin, again, blood flow, nerve sensitivity. We can focus in on the anterior vaginal wall for the G-spot, increased orgasmic strength, and urinary support. But you can also go to the outside and then tighten the outside. So now all of a sudden the laxity we're feeling on the inside, we feel on the outside, clitoral stimulation with that. And then you inject a bunch of growth factors in after with the OShot. So they pair so well together.
I look at that and think, oh my goodness, you've gone into some aesthetic, really, from my own mind for the outside. Yeah. I've made the orgasms are stronger. The tightening, what you feel is just more intense. The aspects of the incontinence gone. You're just thinking, good grief, this is like a dream come true.
Fabulous, right?
This is like awesome. Yeah, it's like this is giving me back 20 years.
No. Well, and again, it's inevitable that we'll have a decrease in orgasmic strength just with age, hormonal decline, but add childbirth to it.
Yeah.
Again,
Right.
Children.
I mean,
they
think
take
about
like a lot of stuff from
Don't
us,
they,
right?
though?
You know,
Yeah.
money.
Yeah, more than just what we're
Age,
talking about.
years, but then
Yeah.
again, you know, it is that vaginal delivery and, you know, obliteration of like lots of things with children. But again, you can get that back.
Right.
And so a lot of people don't know, a lot of women don't know that there's something they can do. And for men, it's more objective. We know if they're having erectile
That's
changes because it's obvious, it's external. But for women, we only know it if we say it.
Right.
And so if you really enjoy sex, which is a huge part of enjoyment in life, unless we're talking about the fact that we're not having orgasms at all,
Right.
or as strong as we used to, or vaginal. Now we're only having clitoral. And some women, you know, again, will only have orgasms if they're doing it
That's
versus
right.
with partners,
Right.
because it becomes more difficult, right? And then, so there's all, and even like stimulation and arousal
Right.
is a huge part.
Yes.
Because you need arousal beforehand to get blood flow, unless if you've had some procedures that help with that, because we don't need that as much when we're younger, right?
Right.
And so, but women will go through and not even complain or think that they can increase or do something about it again. So now all of a sudden they're not
They suffer
enjoying
in silence.
sex
Yeah.
as much as they used to, thinking that's just part of aging.
Yes.
But it doesn't have to be
No.
at all.
No.
You know, we can enjoy sex the same way we did at 20, at 40, 50, 60, 70.
Right.
You just have to invest that time and knowledge and, you know, and again, opening your mind to the fact that there's procedures that can help.
That's right. And if you think, or at least for me, the release you have in a sexual experience where you are orgasming, it is such a mental, completely of letting go and clearing your head. I mean, I just can't even describe it more than that. It's this most amazing thing just to
Intoxicating.
bring you back, yes, and to bring you into some level once you're finished. I'm ready to take on something else.
Intoxicating.
Yeah.
Invigorating.
It is.
You know, it's again part of our well-being. Like we feel better, we feel more, you know, sexual, we feel more attractive. You know, it's stress relieving. We increase our hormone production, you know, just with sex and orgasms.
So wonderful to have a conversation and to for this to be more mainstream.
Yeah.
For our daughter-in-laws and our daughters to understand, you know, it can continue to be good. It can, you know, you don't have to feel like what maybe our grandparents seem to look like to us. No.
Yeah.
That's not.
No, well,
this
and just
time
opening
frame.
conversations between women, between mothers and daughters,
Right.
you know, generations, to know
Yes.
that that's all normal. We're allowed to talk about orgasms.
That's right.
You know, people will talk about hot flashes, but not talk about the fact that they're having vaginal dryness or pain.
Right.
You can't fake pain, but you can fake orgasm.
Right.
And so women tend to do that and not want to open the conversations. But what I love is women are now more empowered than ever to come in and have those conversations. And actually, even the younger, like they won't accept a decreased orgasmic strength at all, because they'll notice after the first child, where we might wait until 3 children and we're noticing it and we're having those conversations.
Right.
But again, opening them up, you know, it's like a sexual revolution that's like, there's no boundaries, right? There's no definitions. There's no boundaries. We need to open conversations between women, between our mothers and daughters, and you know, grandparents and grandchildren, and to know that it's part of enjoyment of life. Like, why are people so afraid to talk about it?
You know, unfortunately, I had a mom who did talk, so it wasn't so hard for me. You know, which was great.
I mean, people are having sex.
That's right.
Like your parents are having sex.
Exactly.
You know? So
it's like,
if you think your parents aren't having sex,
right,
then you know you're just not. You're just not realistic, right?
That's
so everybody, and so again, just opening those conversations. My kids like are completely
my boys
embarrassed
roll
by.
their eyes.
Yeah,
And,
by the fact that I
Mom.
will. That we will talk about it frequently. But no, I agree. There's so many different things we can do now to bring orgasmic strength. And even the fact that women think that lack of vaginal orgasm is not common and they're odd in the fact that they're not having one. They're not.
That's right.
A lot of women experience the same thing. We may be able to get it back with regenerative stuff. And there's things we can add, like stem cell, for instance. You could potentially add some other stuff, exosomes or stem cells to it. But a good starting point is the OShot and vaginal rejuvenation with the laser. And then, again, I want to bring you got to come to the office and have our clitoral rejuvenation treatment. So one of our lasers in particular does the clitoris. And so, again, the clitoris is the penile equivalent, but we just see a small part of it. And so, but it comes down on the sides of the vaginal canal. And so we can hit that with a laser that basically is using the laser wavelength to bring stem cells to the area. So it's called photobiomodulation, and you're bringing stem cells to the clitoris. And so it's a clitoral rejuvenation. So we'll add it on later, or during the procedures, but they'll get, again, a vaginal rejuvenation. I do something slightly different than the Juliet, which is very similar though. You're using heat. Votiva is one of them. We actually have two devices, and the Fotona is one of them. They vary for certain reasons. Like Fotona does more pigment on the outside, where the Votiva does more tightening, on the outside. But the Fotona does that clitoral rejuvenation treatment where we can now hit with just the clitoris. So the legs of the clitoris and what we're seeing, that brings stem cells to the area.
That sounds
and the
good.
Orgasmic strength with that, amazing.
Yeah, that sounds really good.
Yeah. And then people taking pictures before. So it's amazing to me that we'll do the vaginal rejuvenation with lasers and we want to do a picture beforehand. And how many women will not want to take that picture? But if you talk them into it, saying you never have to look at it if you don't want to, it's part of your medical record. But how the ones early on that we actually allowed not to take the pictures, and I don't say allowed, we'll allow you to do whatever, but didn't direct more, are sorry because you start to feel that tightening on the first one. And so when you get to the second one and the third one, you wish, and usually we're doing it at least once a month times 3. And that's a good starting point. Again, it's cumulative, right? There is no limit to the OShots or vaginal laser rejuvenation you do, especially the non-ablative, but they'll start to feel tightening and then wish they took pictures. So now I'm like, you never have to look at it if you don't want to, but let us take pictures. And if you do want to look at it, the second, the third one down the road, it's there. So you can do that. And it's amazing the tightening they get on the outside and internally with the first and the second. So they want to see it.
I was going to say, so you have your aesthetic benefit as well.
No, absolutely.
That's very cool.
I mean, and you can actually take part of the PRP with the OShot and add it into what's called a wing lift. So we're doing PRP into the labia majora, which is the outside, just stimulating collagen, elastin, and tightening and giving volume and, again, just tightening. Some women see that as a problem. They don't view their vagina as, attractive. And again, we're the hardest on ourselves, right? We're always, we never have to worry about anyone else criticizing us because we'll do it very well ourselves. But we can inject PRP, we can do the laser on the outside, we can do the clitoral rejuvenation. There's so many different treatments you can do.
And imagine just mentally, if you feel better, that this is going to benefit what you think is a problem. Oh man,
it's amazing.
It's a game changer.
You just need to have the conversation. So find a provider that's right for you. Start opening those conversations. Do some, OShot, laser rejuvenation. Again, they almost came out and scared people about laser rejuvenation, which, again, if you're just doing it under the care of a physician, you have to trust that that physician knows what the laser procedure is
Right.
about. We're doing non-ablative. It's going to heat. It's going to stimulate. We're not taking anything off.
Right.
It's going to tighten. You can add the PRP on. There's other things we can do in addition to. So did you have nipple PRP
I
done?
did.
Isn't it amazing?
It is. It is.
Amazing.
It is. That was something. I had implants, and after the implants, I was desensitized dramatically from pre-implant.
Which is devastating.
Oh, it is.
Devastating.
Yeah, because pre-implant, I could have a nipple orgasm.
Yeah. Yeah.
It was the craziest thing. So disappointed
Yeah.
after. However, the PRP, I will say, did bring back some sensitivity, which, like I said, that was something I didn't expect at all.
No. And so a lot of our ladies, when we actually combined, we have extra, like our kits are awesome. So we'll end up having, even if it's like a platelet poor plasma, but really it's still platelet rich. Again, it gets diluted the further out from the spin down, that we do, but we'll add that into the nipple. They will come back in and just want that alone.
Yeah.
And so it's cumulative too.
Right.
And the sensitivity you can get back, because again, nipple sensitivity ties into clitoral and G-spot orgasm.
Right.
And it's amazing. And so when you lose that, and breast surgery is a common, breastfeeding is another.
Yes.
And so if you're noticing differences, you definitely want to bring up the PRP treatment under the nipples as well.
Yeah.
It's an amazing add-on to your OShot procedure. And again, we'll talk at something. There's peptides you can do, like PT-141. You can add to it. There's Cialis to Dalafil, or Cialis Viagra combinations you can use for women that are anti-aging.
Wow.
Just a low dose, anti-aging, anti-inflammatory. And it works for women too.
Oh.
The little pink pill, but not really the pink pill because it's compounded.
Yeah.
But, and then you can actually, the OShot even has a new arousal oil that as the CBD oil. So, maybe we'll talk about that a little bit too.
I'd love to hear that.
Yeah. But it's awesome. So all kinds of different things, right?
Yes. It's exciting.
I know.
Yeah.
I'm so glad that again, Paula's not shy about talking about any of this.
No,
and she may even want to add in some stuff now that I didn't bring up. Anything else you can?
From everything we do as women, it should always be to be open, honest, and encourage, so that women who are uninformed or who may be slightly afraid or whatever, doesn't matter, that this is available. This isn't something that is scary or is dangerous. It's
not taboo.
Surgery. No.
Not like odd.
No.
And it's a very common procedure. And if you're in an area, you need to find a good, like a OShot provider.
Exactly.
And again, there's a whole network.
Exactly.
And I highly recommend you find an OShot provider that does some vaginal rejuvenation as well. Ask about the nipple, find a more comprehensive. But again, these are procedures you need to be looking into versus medications and surgery. No, don't suffer, but don't also go through life not enjoying orgasms.
That's right.
We live in perimenopause and menopause for like half of our life. And again, nothing should change. We can optimize hormones and we can do these regenerative procedures and bring back those orgasms.
It's fantastic.
And urinary incontinence. Please don't let your children, leave you with urinary incontinence, when you're jumping on the trampoline with them.
No, because like I said, the orgasms and the aesthetics that you can get from the rejuvenation are off the top great, but to have that incontinence cured is life-changing.
That's right.
Makes you just feel, it just makes you feel 20 years younger.
I agree. So definitely look into it. Thank you so much, Paula, for talking openly about all these procedures. And again, like, subscribe, follow, put in the comments anything you might want to hear about. We're willing to deep dive into anything sexual wellness, and we're here to revitalize your look, your health, and your sex life. Share it with friends and let us know your experiences, any questions you have. Again, we're here to get the message out there that there's a ton of procedures we can do for women to improve their sex life. Thank you.